Hi everyone, welcome and thank you for joining us for today's National Alzheimer's and Dementia Resource Center web seminar sponsored by the Administration for Community Living and hosted by the American Society on Aging. We'll be getting started shortly. The slides for today's presentation are available under the tab on your screen labeled Resources. And under the tab labeled CE Application here, you'll find information on how to obtain CE credit for this event. You'll have 60 days to complete a continuing education application, and it may take up to 30 days from the date of your application in order for us to process and issue your CE credit. If you are not logged in directly to this webinar, that is if you are watching as part of a group and did not log in using an individual confirmation URL, you will not be eligible for continuing education credit because we have no way to track your online attendance. If you'd like to receive CE credit, please be sure you log in using the confirmation URL you receive after individually registering. If you have questions during the presentation, you can send those at any time using the questions box, and we'll save those for the last 10 to 15 minutes of today's program. And now I'd like to welcome Sari Schumann of the National Alzheimer's and Dementia Resource Center. Hi, Sari.
Thank you so much, Betsy, and thank you to all our participants today for joining us for the National Alzheimer's and Dementia Resource Center webinar, Community Health Workers, a Key Support for People Living with Dementia and Their Caregivers. The National Alzheimer's and Dementia Resource Center webinar series is supported by the Administration for Community Living. Before we start, Erin Long of the Administration for Community Living will provide a brief welcome. Erin?
Hi everyone, I just wanted to thank you for joining us today to learn more about very important work of community health workers. I want to thank Alicia Nielson from the WellMed Charitable Foundation and Constantina Mizis from the Latino Alzheimer's and Memory Disorder Alliance for their willingness to share with us the work that they're conducting under ACL-funded programs. I also just wanted to take a quick second to let everybody know about an opportunity for funding for the sorts of projects that Constantina and Alicia are benefiting and their communities are benefiting from right at the moment. ACL's Alzheimer's and Dementia Programs Initiative Grants to States and Communities presently has a funding opportunity, and on the slide in front of you, you'll see some information on it. It's available now, and I would encourage you to look into it as it's a great opportunity to bring much needed supports and services to your community. And with that, again, thanks everyone, and I will turn it back to Sari.
Thank you, Erin. So today's presenters, as you heard, are Alicia Nielson and Constantina Mizis. Alicia Nielson is a licensed clinical social worker at the WellMed Charitable Foundation in San Antonio, Texas. Alicia currently is assisting on the Code Salsa grant, providing assistance to the dementia community living alone in San Antonio. Her previous work includes research in partnership with the Benjamin Rose Institute on Aging and Adult Protective Services, studying the patterns behind self-neglect in elders. We also have with us today Constantina Mizis, who is the founding executive director of the Latino Alzheimer's and Memory Disorders Alliance, based in Chicago, Illinois. LAMDA is on the front line of addressing Alzheimer's growing impact on the Latino community and provides direct services to thousands of Latinos struggling with Alzheimer's annually. At this time, I'll turn the presentation over to Alicia Nielson. Alicia, you can go ahead and get started.
Thank you so much, and thank you for the introduction and for the opportunity to speak today. Like she said, I'm Alicia Nielson. I'm a licensed clinical social worker for the WellMed Charitable Foundation here in San Antonio, and I will be speaking about community health workers in our current grant project, the Community of Dementia and Excellence, Successfully Aging and Living in San Antonio, otherwise known as Code Salsa. So through this project, we hope to identify those in our community who are living with dementia and with minimal caregiver support. We hope to provide a comprehensive safety and support needs assessment to work with the appropriate and involved parties to address specific needs. We also hope to enable patients to successfully remain in their living situation, in this case, their home, for as long as possible. So just to give an overview of the landscape of San Antonio for those who are unfamiliar, You can see in the red areas in central San Antonio is where we are most heavily populated, and the population decreases the further out you expand. We serve San Antonio and the surrounding areas such as Helotes, New Braunfels, and Floresville. However, the majority of our participants are currently residing in central and east San Antonio. So shifting over to the community health workers, or CHWs, who play a major role in our project. CHWs here have a minimum age requirement of 16 years. They are required to complete a 160-hour certification program offered through the local community colleges here in the area. And currently we have 2 CHWs on the SALSA project. They've been on the project with us since 2019, and these CHWs are full-time employees working 40 hours a week and receive an hourly wage. Both of our CHWs were recruited through the WellMed Charitable Foundation, or WCF, hiring process. They're both considered WCF employees, not contractors. And they both report directly to myself in regards to anything related to the project, management, or employee growth. So now for the SALSA program in which our CHWs serve. Participants of our program must be a current WellMed patient here in the San Antonio market. They do not require a diagnosis of dementia, but they must at least be symptomatic and showing some memory loss. They must also either be living alone or living with someone who cannot provide maximum care or supervision. So this might include a spouse who is also elderly or facing their own health concerns, or maybe it's a patient's child who provides care a few evenings a week but works full-time. And then it also must be determined that they can live safely in their home through our Live Alone assessment, which I'm going to explain in a later slide. And then finally, they or the caregiver must consent to the program. Referrals that come to Code SALSA are generally submitted by the patient's primary care physician, or PCPs, or case managers, or the social worker who's involved in the primary care of the patient. And these clinic staff members submit their referrals directly to myself via email, or our medical record software program, or through phone. Once we receive a referral, the CHW will reach out to the patient to first explain the purpose of our program and give them a general outline of what it looks like, as well as discuss some of the concerns that the clinic staff had in making the referral and the different things that we could do to help to address these concerns. They'll also collect some demographic information, things like age and marital status, military status, etc. And then they'll schedule our first home visit to conduct the initial assessment. The initial home visit is a joint visit with the CHW and the social worker. If the social worker determines through the Live Alone assessment that the patient is safe in their environment, then the CHW can move forward in their assessment process. In total, there's 4 assessments patient to agencies or services or provide education to address specific areas of need. The CHW will provide routine follow-ups to reassess the patient's needs as well as the status of whatever community interventions are involved. If it is found at the initial home visit that the patient is not safe in their environment, even with the assistance of community intervention, or if it's found later during the program that the patient is unsafe, then the SALSA team will communicate that with our Adult Protective Services liaison, who is embedded in our WCS office to submit a report to the state. We will then communicate that with the clinic to close out that SALSA referral. The SALSA program is a 6-month-long program, and so during these 6 months, the CHWs work with the LCSW and patient to implement services to enhance the patient's quality of life. After this initial assessment, the CHW and LCSW determine the frequency of contact by creating a color status for each patient based on the intervention need and caregiver status. So a green patient might look like a patient who really needed like 1 or 2 community interventions and has some caregiver assistance present, like that elderly spouse or that child who works full-time. And then this could range all the way down to a red patient who needed several interventions in many different areas and has no caregiver assistance present. We've seen this in patients who maybe never married or had children or have children living out of state and are, for the most part, very isolated with little to no in-person support. The CHWs will routinely visit or contact their patients to continually address the patient's needs or questions they might have regarding community intervention. The CHWs will utilize that HCBS checklist at each of these contacts to track the services that are currently in use, which services were recommended at that contact, was the service accepted or declined by the patient, and then if an application has been submitted, or if it's been approved or denied by the agency. Leading up to discharge, the CHWs will begin to discuss termination as they approach that 6-month post-assessment date. One caveat here is that the SALSA team does not discharge if we feel interventions are incomplete. If it's clear that the patient is still in need of several services, or if new needs have recently come to light, or if we are still in the process of obtaining services from a specific organization, we will extend if appropriate. And at that post-assessment, the mini-COG, down-call, and live-alone assessment are again conducted. We then compare the pre- and post-assessments to see the effectiveness of community health workers and their use of community agencies to assist these patients in improving quality of life. Following discharge, there is continued follow-up from the clinics. Although we have not experienced this yet, re-referrals are possible. This could occur if the clinic observes a change in the patient's condition or if there's a change in caregiver status. Maybe a spouse has passed away or the patient, for whatever reason, has become more isolated. The SALSA team will then determine if the patient is still safe in their environment given these changes and if an admission to the program is appropriate. So since the pandemic, we've had to pivot in a lot of our protocols. Since March 2020, we have conducted all no-touch contact with our participants. All of our assessments and follow-ups have been completed through phone or FaceTime. There's also been an increase in frequency in contact to these participants. So where we once determined the frequency through that color code status, all patients now receive a weekly or biweekly follow-up regardless of the number of interventions or caregiver status. There's also continued follow-up beyond the 6-month mark. Even after the post-assessment is administered at 6 months, every participant, unless they wish to decline follow-ups, continues to receive weekly or biweekly follow-ups from their CHW. And obviously, since the pandemic, this population has had to increase isolation to observe safe distancing practices. So in turn, we've increased contact with our SALSA team to increase that socialization and monitoring of the patient's needs. Okay, so here's a case study, and this was pre-COVID, so our assessments and home visits were in person. We received a referral for an 87-year-old female, and the referral from the clinic read, "Patient is living alone and her children live out of state. She is becoming more weak and is requiring more assistance." So the challenges that were present at the initial visit were things like she was having difficulty with her activities of daily living, or ADLs. There was some financial stress as she was in debt. And then she was partially blind, so she was having difficulty with some everyday tasks. And then there was also a fall risk. Whenever she tried to bathe, she had one of those standard bathtubs, which required her to lift her legs over to step into her tub shower. So the services implemented for this patient included services from Lighthouse for the Blind, which is this incredible organization that provides in-home assessments to provide skills training and low vision devices to those who are legally blind. Our patient was able to receive assistance from this organization by having an individual come in to provide that skills training, as well as provide some free devices that would assist her around her home. We were also able to connect our patient to the WellMed Economic Security Program, which connected her to a social worker who provided assistance and counseling to address her financial stress, her debt, and increase financial wellness and connect her to different savings programs. We were able to obtain provider services through the state to have an attendant come in and assist the patient with her ADLs. And a local aging organization came to install grab bars in the patient's shower to decrease that fall risk. And then finally, we increased emotional support and socialization through regular check-ins with the CHW. This patient loved to talk and tell stories, and she was so excited anytime that the CHW called or visited so that she could have someone to talk with and express her concerns to, and really just have an ally who was well aware of her situation. So you can see the differences we found in comparing the pre-assessment to the post-assessment. There was some cognitive decline over those 6 months, as evidenced by the mini-cog. There was improvement, however, in her reported quality of life as determined by the DUM-QUAL. So her points went up from 70 at the initial to 87 points at the post-assessment. So in conclusion, here are a few of the preliminary program findings we have found for the Code Salsa program. We've seen an improved quality of life as evidenced by increased scores in the DUM-QUAL. We've also observed an increase in implementation of services for our dementia patients and the positive effects regarding safety for them. So, for example, patients and their caregivers have been able to have decreased concern with cooking or operating the stovetop through home-delivered meal services that have been implemented. Another example is that patients have been able to limit their driving time. Many of our patients we find become very anxious when they are forced to drive either to their doctor's appointments or to the grocery store even. So with transportation interventions, we've been able to decrease that concern of putting our patients and others in the community at risk. Finally, we've been able to improve communication between the patient and their provider. By having our community health workers act as a liaison or an advocate for the patient, we have been able to quickly notify the PCP of any patient concerns regarding his or her care by creating this constant communication system between the patient and their physician. And that concludes my presentation. So here is my contact information if anyone has questions later on or wants to further discuss our foundation or the SALSA program.
Thank you, Alicia. Constantina, we'll move right on to you.
Thank you. Hi, this is Constantina Mizis, Executive Director of the Latino Alzheimer's Alliance, and thank you so much for attending. Our program calls por una mejor calidad de vida, for a better quality of life. And this program is based on the community health workers. We started in 2018 supporting by the administration community living. And this, I'm showing you right now the geographic area where we are serving at this moment, which is North Cook County, West Cook County, and South Cook County around Chicago, Illinois. And here are the objectives. Identify 5 important dementia-focused interventions implemented by community health workers or promotoras de salud. Identify effective bilingual, bicultural, dementia-capable direct support services. Let's talk about the impact first. More than half of non-white Americans believe significant loss of memory of cognitive abilities is a normal part of aging. Hispanic Americans are twice as likely as whites to say they would not see a doctor if experiencing thinking or memory problems. 1 in 5 Hispanic Americans, that means 20%, say they will feel insulted if a doctor suggested a cognitive assessment. We have more. Nearly 2 in 3 caregivers, which means the 64% across all groups, say that caregiving is stressful. Risk factors are compounded by the barriers faced by the Latino community, such as lower education and income levels and healthcare access. As a result, Latinos are more likely to delay treatment and receive inadequate care for ADRD, which is exacerbated by difficulty communicating with providers. Working with the community health workers or promotoras de salud. An important strategy in increasing culturally component services for the Hispanic community is working with community health workers. And that means that we are building trust in the community through promotoras. Community health workers are members of the target population, which means they share social, cultural, and economic characteristics. Community health workers can raise awareness of ADRD in underserved population and bridge the gap between health institutions, available resources, and communities. Promotoras or community health workers can recruit and educate caregivers by visiting churches, community clinics, parks, senior centers, schools, etc. The community health workers' roles are patient advocate, educator, mentor, outreach worker, and translator. How the role of the social determinants of health work. Social determinants of health are the conditions in the interventions where people are born, live, learn, work, play, worship, and age that affect a wide range of health, functioning, and quality of life outcomes and risk. And this can be grouped into 5 domains: economic stability, education access, healthcare access, neighborhood and environment, social and community context. And let's see, education access. Hispanic adults with less than a high school degree are 68% less likely to visit a doctor or access care compared to those with at least a bachelor's degree. National Assessment of Adult Literacy is what it says. Interventions. LAMDA developed partnerships with community college and other community organizations that offer educational programs at no cost to community health workers, including GED, ESL, nursing aid, social work. LAMDA community health workers go into the community and conduct educational sessions with community members about keeping their brain healthy, and normal and abnormal signs of aging. Through caregiver trainings, LAMDA works with caregivers to help them make tangible action plans and manage the symptoms of their loved ones in order to increase their quality of life. Healthcare access. Hispanics are 3 times more likely to be uninsured than non-Hispanic. Without health insurance, people are less likely to have a regular health care provider and more likely to skip routine health care. In other words, if we do not educate them or if we do not guide them on the resources, then we're going to have more people in the emergency room. Interventions. Organize physician participation from community clinics to promote understanding between providers and patients. And again, this is building trust. Encourage individuals to see a physician for diagnosis and or treatment to avoid future visits to the emergency rooms. Invite the expert from the Department of Health Care and Family Services to inform the community members about where and how to apply for medical benefits. Partner with the Illinois Department on Aging Division of Older Americans to train community health workers about available resources and benefits. Community health workers can then make direct referrals when seniors and caregivers request help. Neighborhood transportation. 38.9% of Latinx live in households with one vehicle. Low-income Latinx spend more time traveling to daily destinations because they have fewer private vehicles and use public transit and carpools more frequently. Interventions, what we can do. Create and or operate bus transportation systems that link the community to health centers and health fairs. Also, develop partnerships with local governments for transportation services that link the community members to health center and community clinics. Social and community context. People's relationships and interactions with family, friends, co-workers, and community members can have a major impact on their mental health and well-being. Many people face challenges and dangers they cannot control, like unsafe neighborhoods, discrimination, or trouble affording the things they really need. This can have a negative impact on mental health. Interventions. Help people get the social and mental support they need by offering programs like memory cafes, karaoke, and field trips. By the way, do you know many of our seniors in Chicago and suburban area who have been living here for 40 years or more, they never have been visit the Lake Michigan. So we do this kind of field trips, and they are really, really excited about it. Develop partnerships that will host your events outside your facilities. Again, district parks, farmers markets, have physical space and other resources for day-to-day program activities. Economic stability. Low socioeconomic status, SES, is associated with an increased risk for many diseases, including cardiovascular disease that can be a trigger for dementia. Intervention. LAMDA provides bilingual financial coaching to educate and inform caregivers and address their unique financial needs. Community health workers receive Then we have effective bilingual bicultural dementia capable direct support services LAMDA offers trainings to community health workers by using the Act on Alzheimer's collaborative training that includes disease description, demographics, societal impact, effective interactions, cognitive assessment, and value of early detection. Develop and track community health worker outreach plans and education efforts to identify any additional training needs. Sometimes promotoras or community health workers need technical assistance, like during this pandemic, they were receiving training on how to know more about computers and other social media, etc. Facilitate caregivers training in Spanish, delivery of behavior, symptom management training, and expert consultation for family caregivers. Effective bilingual, bicultural, dementia-capable direct support service continue. Inform, enroll, and provide appropriate programs to community resources to individuals living with moderate to severe impairment of ADRD and their caregivers. LAMDA's community health workers provide services at community health fairs in collaboration with the Illinois Department on Aging, Division of Older American Services, and Area Agency on Aging number 13 in Illinois. Conducting dementia capability assessment. This assessment tool is designed to measure the dementia capability of the long-term services and supports in the organization. Increase cultural competence and linguistic appropriateness of services dedicated to caregivers of persons with ADRD. Involve faith-based organization leaders and members. For the Latino community, priests, churches, is a place where they stop. When they just immigrate, this is the first place where they go looking for help. And then they continue. Local media representatives, policymakers, and local government officials. Identify potential partners in the community like nurses, doctors, hospital and health clinics administrators, individuals from volunteer agencies, representatives from local business, pharmacies, grocery stores, etc. Representatives from local homeless shelters and food pantries or food banks. Working with community health workers, outcomes. 60 in our program, 60 community health workers from suburban Cook County informed a total of 6,887 Hispanic individuals about for a better quality of life. A total of 710 memory screenings offered during the first year, increasing knowledge of risk factors associated with dementia and encouraging individuals to see a physician for diagnosis or treatment. Community health workers encourage a total of 570 individuals to see a physician for diagnosis and or treatment. This is just in the first year. Continue with the outcomes. 60 community health workers provide 4-week family caregivers skills program, SAVI, adapted for adult Latino family caregivers. SAVI educational sessions provided to 107 Latino caregivers delivering behavioral symptom management training. 50 community health workers also provide individual care consultant, what we call CC, service to 314 persons in the community with possible cognitive impairment who live alone or were at high risk of ADRD. 12 health fairs were conducted, of course, before COVID, in collaboration with key partners like the Illinois Department on Aging, Division of Older American Services, Area Agency on Aging number 13 Illinois, Mexican Consulate, Sinai Hospital, Alivio Community Clinics, and 8 suburban Cook schools. Why schools? In the Latino community, the grandparents are the ones who pick up children from schools and take care of the children after schools. So this is very important. LAMDA provides a total of 6 radio interviews and 2 TV interviews, reaching approximately more than 7,000 Latinx. A total of 7,000 fact sheets disseminated in the community, churches, community clinics, district parks. LAMDA staff tracked a total number of 8,834 individuals, reached by the number of likes, comments, shares, and by collecting information through surveys for traditional media. This is my contact information. Do you have any questions? We are always here to support any organization across the nation. Thank you so much.
Thank you so much, Constantina and Alicia, for your presentations. They were excellent, and we have a lot of questions coming in right now. Just going to move to our question and answer slide with the funding opportunity announcement reminder as well that Erin Long mentioned earlier. Please enter your questions into the chat box, and we will get to as many as we can. There was a question that came in about what type of dementia and aging training specifically is provided to community health workers, anything beyond what you mentioned in your presentations or continuing training throughout their employment as community health workers. So Alicia, do you want to touch on that first, and then we'll turn over to Constantina?
Yes, definitely. So WellMed Charitable Foundation as a whole continues to receive training opportunities through United Healthcare because we sort of fall under them. And so we have continuing learning opportunities and education courses that we take, as well as our office network is very good about spreading the word about community trainings happening. They've all been virtual this year that are more focused on the population that we are serving. And then we also work very closely with the Alzheimer's Association on this project, and that has created a great opportunity for our CHWs to continue to sort of be refreshed in these different areas and learn how to also present different topics related to Alzheimer's and dementia to our community.
Great, thank you. Constantina, can you talk a little bit about all of the dementia and aging training? I know you mentioned some of it. Is there anything else you want to add about that?
Not really, just to highlight the strong partnership that we have with Sinai Hospital and Alivio clinics in the community. And a point that I would like also say that it's very important that whoever you would like to have as a partnership for any program with relating to the Latino community, of course, must be an institution or organization that the Latino community already trusts in.
Great, thank you. We had a question come in about how community partners or those who work in the community can be supportive of the work of the community health workers and people living with dementia in their communities. So if people come in contact with pharmacists and grocery store workers and postal workers, have you encountered any or have you done any work with community partners in that regard? Alicia, have you at all?
Yes, definitely. So I'm going to speak a little bit. HEB is a big grocery store here in Texas, if you're familiar, and I think they were a great example of a big company here in Texas that really helped out our specific population, well, WellMed as a whole, so the elderly population as a whole, in providing groceries for those seniors who, again, had to stay isolated due to the pandemic, and just really were having a difficult time obtaining groceries just because they did not want to go out in public when we were kind of in the midst of that beginning of the pandemic. And so it's been really neat to see our community as a whole really kind of have this focus on our aging population through this pandemic to try and keep them safe, and kind of alter our different protocols that we once had to better serve them. So that's one example that comes to mind is our big grocery store team here in Texas.
Great, thank you. Constantina, do you have anything you'd like to add?
Yes. Talking about us here in Chicago and suburban area, the Univision TV and Univision Radio helping us all the time since many years ago. So they also, the Latino community trusts a lot of them, and we take advantage of that. So we continue communicating through this traditional media, TV and radio, the community about any benefit or during this time, absolutely food banks and whatever they need. Very important. Last Thursday, we have Moderna COVID vaccines in LAMDA in our office in Cicero, Illinois. And this kind of things are supporting, in this case, by the city of Chicago, but also the pharmacy was Jules Osco. And also over there we have another partner that is state representative across the street that came and was helping the community, the seniors to fill up applications on receiving and resources to cover their up to 5 months of rent or any utility. So we have the whole huge neighborhood Latino with Latino population where everybody is supporting.
Great. Thank you so much, Constantina and Alicia. We just have a few questions came in about the same topic. Can you talk about some strategies you've used to recruit community health workers for their current positions in your projects right now? And I would add, and how you encourage them to stay. So how do you recruit and then keep them around? Constantina, do you want to start?
Yes. I said I would like Alice to start because I have much to say about this. Community health workers, they usually are women who do this between the time where their children are in the school. Okay, so what I'm saying is that they have to have flexible hours, and we are happy with that. How we find them? Through other organizations. Let's say you need and you have to write a description, what you're looking for, and what kind of training will you provide. And then go spread the word in other organizations, but be sure that those organizations or churches or schools are in the neighborhood you want to target the population, okay? And what community health workers is very attractive for them is, of course, that they have to have at least a stipend, receive a stipend, because they pay transportation. So at least a stipend will be great for them. And the other thing is they love to receive training. When we provide them educational workshops, trainings, they are very happy because they want to increase their level of education. We have partnership with couple of colleges here in Chicago, so they can go and learn, have English as a second language or GED, or even start a career of social worker. Depends where their level of education is. And we have a partnership. They don't pay anything. This is very attractive for them, I will say.
Great, thank you, Constantina. Alicia, do you have anything you'd like to add, or can you tell us a little bit about your strategies for recruiting community health workers?
Yes, definitely. So our community health workers were recruited through our HR, our hiring process. And I know that there was a lot of focus on reaching out to the professors or the instructors at the community colleges that were instructing the CHW training courses. And so when some of those CHWs were certified, there was already some opportunities available for them to come and interview with us for this available position. And so I know a lot of them came from that opportunity. So I think kind of just reaching out locally to the different training programs out there. And then as far as retention goes, I think just allowing them to really be present and exploring their own community and the networking that's available for them, because CHWs have such broad knowledge that can really extend across a lot of different populations. So I think allowing them to really go out into their community and network face-to-face, pre-pandemic, networking with all different types of agencies out there. We also gave a great opportunity for one of our CHWs, and she was invited by the Alzheimer's Association to attend their national conference out of state to, again, kind of expand her knowledge in that, through that organization, and then network as well. And so I think kind of allowing that freedom is good.
Great, thank you so much. A few questions have come in about instruments that were mentioned during the course of the presentation, and I just wanted to make sure people take a look at some of the responses that came into questions through the chat pod, where I provided a link to an instrument resource list that the National Alzheimer's and Dementia Resource Center developed and put together a few years ago. That's from our website. That should be very helpful to those of you who have asked some of those really pointed, specific questions. So let's get to another question that has come through. So when you think about the specific training that you give the community health workers, someone has asked, is there any training on how to manage the emotional needs of the people living with dementia and caregivers, the ups and downs they may see just based on, for caregivers, based on changes in the person living with dementia, different behavioral things that come up. Is there any specific training like that you can talk about? Alicia, do you want to start?
Yes, definitely. We were able to give our community health workers an opportunity to attend a caregiving training course that we offer to our patients' caregivers. And a lot of it had a big focus on stress reduction. And so we were able to allow our community health workers to kind of sit through that training that's offered to the caregivers to better understand the strategies that are not only given to the caregivers, but what caregivers and patients face as well. And so I know that was a pretty effective training for them, as they reported, of just kind of being mindful and using those stress reduction techniques.
Thank you so much. Constantina, you have anything you want to add?
Well, in our case, we have what we call retrainings or refresh trainings. So our health promoters come to the center every other week. They pick up their check, they pick up material, and we just have a feedback. We have lunch for them, etc. So over there is when we take advantage of their time, and we have always a special guest, what we call. So we invite psychology from Sinai or from Alivio or a nutritionist and be sure that they are eating well, they are mental and physical well, you know. So we provide this. Is what we're doing.
Great, thank you. It would be great if both of you can talk a little bit about your plans for sustainability of your current programs and how you might be able to sustain various parts of your program or maybe specific aspects of it. Constantina, do you want to take that one first?
Yes, absolutely. Well, the sustainability will be based also in our great partners, in a specific hospitals and clinics. In the colleges, because the colleges are supporting the health promoters. But I will say, I will remark again that why hospitals and clinics must participate in this, because they do not want more individuals in the emergency room. So that's why. Sorry, if you permitted me, I see a question that is very common, that it say if they need to be certified, the community health worker. May I? Yeah, okay. That depends on, that depends on the state you are or in the city you are. But please do not forget that your own culture, your cultural skills cannot be certified. So if you think about it, the bottom line with community health workers are that they are experts in their own culture and traditions that we want to go through to send the message in a specific where we want and what we want to say. So for this, they need to be highly competent on their neighborhood population traditions. So the answer is they do not have to be certified, because you don't get certified about your own skills regarding your own culture. That's all I want to say.
Very good information. Thank you for sharing that. Alicia, do you want to talk a little bit about sustainability efforts with your program?
Yeah, definitely. I think in an ideal world, CHWs would become a permanent part of WCF, and what they're doing now, working with the dementia population and their caregivers, would be just kind of a regular system that they have, right, along with the PCPs and the social workers. And so I think sustainability-wise, that's something that we definitely strive for, and that's something that we've, I think are definitely kind of creating little blips in the radars of the different physicians and specialists here in our medical group of just kind of recognizing our specific dementia population who is living alone or living with minimal caregiver support, is kind of recognizing those individuals and families and kind of stepping up and connecting them to the resources that are available through WCF that we can provide to them. And so hopefully this could one day become a permanent thing that just becomes a regular system, part of the patient's care.
Great, thank you so much for your responses with that. So, Constantina, we did get one question about the statistics that you included about the Latinx community. Can you talk a little bit about the statistics that you provided? Are they national or local, so that people can get a sense of what universe you were talking about?
Yes, absolutely. The statistics were national.
Great, thank you. So we are running out of time, but I wanted to leave the last minute or so open for both of you, Alicia and Constantina, for any last remarks about your programs or any key points that you wanted to make sure you were able to get across to the participants today.
I just want to say, this is Constantina. I just want to say that we are here to help. We are here to support because if we support each other, the result or the impact will be in the number of individuals that will get benefit. So we just feel free to email us, and I'm sure Alicia too, and we can help you with anything you need.
Thank you so much. Alicia, anything you want to mention before we wrap up?
Yeah, I think just to piggyback off of that, I'm really open to kind of further discussions if anyone wants to reach out to me, but I really feel that our CHWs are making such an impact on our community, and I really hope that this profession can more widely expand and be able to kind of grow that impact. So.
Great, thank you so much. Well, we want to say thank you to both of our speakers and to all of you who participated today in this webinar. Please join us for the next National Alzheimer's and Dementia Resource Center webinar on May 18th, which will focus on person-centered goal discovery for people living with dementia. The registration link and information on the session is available on the ASA website. I'm going to turn it back now to Betsy Dorsett for some final remarks, and thank you again, everyone, for joining us today.
Thanks, Sherry. Thanks so much for this great web seminar.
Thank you, everybody.
If you'd like to claim CEUs for this event, you'll receive a follow-up email by the end of the business day that will contain a link to the CEU application. That email will also contain a link to today's slides. You'll have 60 days to claim CEUs for this webinar, and it will take 30 days from the date of your submission in order for us to process and issue your CE credit. Thank you, everyone, for joining us today. Have a great rest of your day.